Let's get more reaction now to the Prime Minister's news conference. Joining me from North London is the chair of the British Medical Association Council, Dr. Chaand Nagpaul. Thank you very much indeed for being with us, Dr. Nagpaul. First of all, the £3 billion that's been mentioned as extra funding to deal with COVID and consequences through the winter. What do you make of that?
From our end, the most immediate priority is the fact that we've seen a huge backlog of untreated patients over the last few months. Our own analysis shows about 2.5 million patients have not been seen in outpatient clinics for care, and about 1.5 million patients have not had their operations done. And those patients are now waiting. They're wondering when they'll be treated. Many are suffering. Many have conditions which could become far worse, and some may end up with life-threatening conditions if they're not treated. So we didn't hear anything from the Prime Minister around how we tackle that. And that has to be a priority because we can't go into winter without tackling the needs of those who have suffered, those patients who have not had COVID but have suffered and will continue to suffer. So when you look at that, we need to understand, will £3 billion be enough? It's less than 3% of the NHS budget. We also need to move beyond just numbers in terms of figures of investment into some operational plans, into modelling exactly how the NHS will cope with the increased numbers that each winter place demands on our health service, including, of course, seasonal flu, and also modelling around the possibilities of future COVID outbreaks. And then we can understand and see whether this money is going to be enough or not. At the moment, we don't have any of that detail.
Now, some of these funds are designed to keep the Nightingale hospitals open. Doesn't that attend to some of your concerns? A, because it takes pressure off other services in NHS hospitals, and B, because I understand some of the Nightingales are now being used for things like cancer screening.
Yeah, so one of the real limitations we have in our health service is a lack of workforce. We entered the pandemic with about 10,000 unfilled doctor vacancies and about 100,000 vacancies in the NHS. What we did during the first peak is suspend or put a standstill on ordinary care for patients who didn't have COVID, and we've seen that significant numbers of excess mortality has arisen because we didn't treat those patients. We now, of course, have millions who are waiting for treatment, the backlog, and so we can't have a situation again in the future where we have the Nightingale open and the same doctors who would be treating other patients are now only treating COVID patients, and then, of course, having other patients suffering. And in fact, those patients in the winter will have respiratory conditions, they'll have heart disease, maybe heart failure, and so we need to make sure that we have a health service that can meet the needs of COVID and then a COVID outbreak, but also continue its normal operations. And that is the biggest challenge we face. And we haven't seen details of how we will be able to do so. And so we can't have, a doctor can't be both in a Nightingale hospital and in a district general hospital dealing with that winter surge at the same time.
Now, as far as COVID is concerned, the Prime Minister was positive that the R rate is continuing to be below 1, that it might be possible to end social distancing by November, to have people going back to football stadiums. Do you think that is justified on the clinical evidence that your members are experiencing now in relation to the COVID infection and cases of it?
I don't think that it's possible to make any promises about the future. It took us by surprise that a city like Leicester had to have a local local lockdown, and that's because the virus is just as contagious today as it was at the beginning of the pandemic. And you can go from a situation where we feel we're in a stable position to having an outbreak quite rapidly, even in a workplace, and we've seen that in other nations. So we certainly should not be making any promises. And in fact, I think that we aren't doing enough at the moment to bring the infection rate down further. You know, having an R rate of 0.7 to 0.9 is still too high, where the ONS say that we've got 1,700 new positive cases every day.
So
That's
you wouldn't
far higher.
back the easing of the lockdown that he's outlined again today over the next few months?
No, what I would say is that the easing of the lockdown must be met with clear measures to prevent spread. And an example of that is that we heard today from the Prime Minister about the 1 metre rule. Now, I wasn't aware that social distancing had reduced from 2 metres to 1 metre. What we heard before was that there was a 1 metre plus rule, and the plus referred to additional mitigations. It's that sort of, measures that we need to ensure is clear to the public and clear to employers. So what we need to make sure of is that as people go to work, those that have to go to work, that employers know exactly what constitutes a COVID secure environment. I also think employers shouldn't just be left to get on with it. The government should be supporting employers to make sure that they have the support to enable that to happen. That may require adaptations. It may require, for example, perspex screens between employees, and it certainly should involve the wearing of face coverings where people are not able to socially distance. And again, that goes back to a lack of clarity of public messaging, because we heard about the need for face coverings to prevent spread in public transport, but nowhere else. That was the first announcement. We now have that for shops. But in fact, there's been confusion about whether that should apply to offices, and that occurred just this week when the health secretary wasn't sure. We can't ease lockdown with a lack of clarity. There needs to be very clear, robust measures taken so that you can safely ease the lockdown. So it's not about whether you ease down the lockdown or not. It's about how you do that safely, and you can do much of this safely if there's clear regulations, clear adherence, and the government puts in place measures to ensure that adherence.
Thank you very much indeed for joining us, Dr. Nagpaul.